ACL tear, Anterior Cruciate Ligament tear. It is one of the most important ligaments of the knee joint. It is inside the knee and connects the thigh bone to the leg bone. It helps in giving stability to our knee and also prevents pivoting of the knee joint. Most of the time, this ACL can get injured while playing sports, sometimes road traffic accidents or any undue events. The ACL can get injured. When it is torn, we can see swelling, pain, and difficulty in walking. And sometimes some patients even complain that they hear some pop sound and they lose the control of the knee joint, which we typically call giving way sensation, where when you try to load and walk on the knee, it slips. So immediate first aid, rest, ice packs, compression and elevation. Meet your doctor. Probably they'll take an X-ray and sometimes an MRI scan to confirm the diagnosis and follow what your doctor says. If there's a partial tear and if it is not very demanding person, then we can treat it non-surgically with painkillers, exercises and physiotherapy. If it's a demanding person in sports and if there's a partial tear, I normally like to fix it arthroscopically, which we call ACL reconstruction. And when there's a complete tear, again, the same thing which we have to do it is treat it surgically, which is arthroscopic anterior cruciate ligament reconstruction, or sometimes we call ACL reconstruction. So don't avoid your ACL injuries, because this ACL injury will create your knee unstable and it can lead to a permanent damage of your knee joint. Arthritis is quite early in such kind of a deficient ACL knee, so please get treated.